So Rohit, how was your week?
This week, actually, what did I? So at the moment, my life's a bit crazy, but this week was a very good week. Currently, I work in a trauma and orthopaedic surgery department, which has been fantastic. I've had a week where I found out that I'm able to finish some of my training a little bit early. So I'll have a little bit of time off with my family, which has been an amazing bit of news. But also we've done quite a lot this week. We're busy. I ended up having to work sort of what we call trauma theatre, which is basically anyone who's broken something that comes into the hospital and needs an operation. So we've done that a couple of times this week, which means a fair bit of operating time, which is always, for me, fun, interesting. And then depending on who you're with, I've been lucky this week. I've been with sort of people who are quite senior and actually will let someone at my stage do a lot more. So depending on who you're with, you can end up operating quite a lot, or you can end up assisting and watching, which you still learn, but it's not as much fun. Or it never is. You guys know what it's like. You remember dental school and and suctioning for people.
I don't know if I'd do it again if I had to go back.
Yeah. Sometimes it can be painful, but most of the time you're kind of, because of the way most MaxFax trainees are and the way our journey is, you kind of take things away. Like I chose to do something called core surgical training, which allows me to sort of dip into other specialties and see what they do. But through sort of med school and what I've done, you end up doing a lot of sort of MaxFax work. So you kind of look at other specialties and you then say, what can I take away with me? In the same way, I'm sure like now that you've done parts of dentistry or parts of implants, things like that, like you look at things and you say, I know what I want to take away. When you go and see someone else, you don't really just say, right, I just need to know each step and just say, I need to learn it like that. You say, actually, I'm going to take this away with me and this is what I'm going to try. So it's quite a nice position to be in, if that makes sense. So yeah, I can't complain. Good week so far.
Yeah.
Tiring, as it always is, but what's not, hey?
So Ali, how was your week?
I actually had a really chilled out week for once. That's the first time ever. There's been this like weird virus going around and everyone's been ill, and it's not often that I like don't go to work, but I can't cough through appointments. It's just like there's something, how I feel I can get through, but I can't cough through an appointment. So it was like one of the first times that I've just gone, I can't work. Luckily, I had a few admin days that I could move things into, and that was fine. But we closed the practice for Christmas this week, and when we opened the practice, we said we close at Christmas. Because what tends to happen in the practices I've worked in, I always used to be on call or come in and have a normal diary, and everyone in like October or November, they think, oh, it's a great time to book appointments. I want to go see the dentist, get this done whilst I'm not in work. And then as soon as they start their Christmas holiday, they go, the last thing I want to do is leave my family to go in for an appointment. So everyone cancels. Then you have all the team sitting there all frustrated and bored. And so it just made sense. So basically, we closed for 2 weeks over Christmas, and we've closed, and I went to go feed the ducks with my daughter.
Aww.
And yeah, I've just been hanging out. It's been awesome, yeah. So I'm very relaxed. How was your week?
Well, I had a panic attack on top of a mountain yesterday, so that was fun.
What happened?
No, I was doing a race, and it's a fell race. So the idea is you literally like run up a mountain and run down a mountain. And I have done this one before, but I had the wrong shoes, and it was incredibly windy, and I went over the top, and this massive gust of wind just hit me and completely like lifted me up and sent me flying, like proper like cow in a tornado, sort of like taken out. And I still took a bit of a tumble. And then usually I'm pretty fearless running downhill, but I was like, oh my God, what's just happened? And started being like, ugh. And some middle-aged man just grabbed my hand and was like, come on, you're coming with me, and just took me down the mountain.
Oh man.
And then I had an adrenaline rush and I absolutely sprinted the last 2 kilometers.
What was your time like?
Oh, it was better than when I did it before, but it was not my best race. But yeah, that summed up my week.
Brilliant.
But yeah, it's other than in terms of
a week of highs and lows.
Yeah, took out a lot of teeth at the prison this week, which was fun.
Cool.
So that was yeah, that was good.
What happens if you can't get teeth out or if they break or something at the prison?
Oh, I can get the teeth out.
I love it.
No, there's Morriston Hospital, so you
Cool.
can. We did actually have to sort out a couple of referrals for some big sort of abscess and things. So it's actually a taxi that comes and then takes them to the hospital. So yeah, if you can't get it out, there are things, and there's a dentist as well that actually comes in, and he's an oral surgery specialist. So he comes in like once every couple of months and there's a few like big cases that will be scheduled in with him to do like some more like really complex surgical things. So yeah, they've got good systems going on there. But yeah,
Cool.
I haven't had any problems. I've got all the teeth out.
It's because of your training.
It is. It's all you. But on that note of sort of surgical specialists, to the voice you heard at the beginning, we are joined this week by Rohit, who is an OMFS trainee. He graduated from Cardiff University in 2012, obtaining a degree in dentistry, and then in July 2019 graduated as a doctor from King's College London, thereby obtaining dual qualification in both medicine and dentistry. This is as part of a long-term goal to become an oral and maxillofacial surgeon with an interest in trauma, facial deformity and head and neck cancer. He's had a very varied career working in both general dentistry and then pursuing the oral and maxillofacial surgery. During his time as a foundation doctor, he played sort of a leadership role in managing junior doctors in the previous COVID crisis at Watford General Hospital. And he currently works as a core surgical trainee at Watford General Hospital doing orthopaedic surgery. He's completed rotations in ear, nose and throat surgery, and outside of his commitments, he works as a Tier 2 IMOS Oral Surgery Practitioner, taking on the medically complex or difficult surgical extractions. He enjoys teaching and has experience teaching oral surgery from both practical and theoretical elements. And also is a reviewer for the British Journal of Oral and Maxillofacial Surgery. So, have you always wanted to do Max Fax then?
No. No, the reality of it, in truth, I started off having sort of GCSEs, did my A-levels, and me and my friend, literally, we sat together and we were like, what do we do? We did reasonably well in our AS levels, and we both were like, what do we do? We didn't have any idea. And he sort of said, shall we do dentistry? I was like, yeah, fine. And I looked at it as a sort of work-life balance. I didn't come from a really wealthy background or anything like that. So for me, it was just let's sort of do something where you can earn a reasonable income, but actually you can be at home or you can spend time with your family and things like that. And went to dental school, worked really hard. Ali will know. I think we both worked hard through that and played a lot of football together.
Yeah.
But I left and I finished, and I think in our final year we got to see a bimaxillary osteotomy by Mr. Cronin in Cardiff, and it just became interesting. And I was like, okay, let's just try out a hospital job. Let's see what it's like. And I think it was just, you kind of went from this part of anatomy and your mouth, and you kind of it just explodes. And you're put in this environment where actually it can be very scary. Like, and some people will say to you, oh, you can sink or swim in that environment, because you're doing medical things without the full medical training. Mm-hmm. And it's quite scary. Like the first, for me, I think I was working in Coventry. I was working in Coventry, and essentially I get a phone call from A&E, these A&E consultants and resus, and them saying somebody has been attacked by a machete. And that was the call I get. And somebody is bleeding.
And this is a Max Fax post, Ro?
Yeah. So I did a year of Max Fax work in Coventry after I'd finished my VT. Mm-hmm. And there's me essentially a part of you thinks in your head, all I'm thinking is, are his teeth okay? Like that's as far as my knowledge went at that point. Like you have this induction and these wonderful trainers and there is a hierarchy for that reason, and it exists for anyone in hospital, that you have senior people who you escalate to. But the idea is, even at this stage, you're expected to be able to take a history. You might not necessarily know all the things to examine and all the questions to ask. So there's me doing all of this and thinking, I am way out of my depth. And even in them times in VT where you've had that extraction where you can't get that tooth out, somebody's got a sore at the corner of their mouth and you're feeling really guilty thinking, I have to refer this on at this point. And you're like, I wish, like, you kind of just, a part of you thinks, I just need to know more. And that's how it kind of started for me. I was like, I can't do this job without knowing more. And the first 6 months, in truth, because you're so junior and you don't know that much, you do a lot of, I'd say a lot of paperwork and less sort of operative things. Like you're assisting a lot, you're holding suction a lot. And then suddenly, like after 6 months, like some of my seniors just started letting me do more. So I didn't learn to take out a wisdom tooth at that point or do surgical extractions, but actually, like, I had seniors who were saying, you're going to fix this jaw or you're going to fix this mandible. And actually, like, that's when it started to become enjoyable, right? Because people were letting you do stuff. You have to earn the right to do that. Like, that's how you have to see it. But I just kept working hard, and I had people who were very supportive, because all they wanted was, actually, they just want to know, can you, one, be safe? Can you care for the patients that are there? But two, you don't have to have all the knowledge at that stage. They know that you don't as a junior. They just want to know, do you want to learn? And if you want to learn, then people are willing to give you the time. I'm sure even now when you guys meet people and colleagues, if they're willing to learn, you're like, yeah, let's teach you. Actually, like, even now to this day, it's probably the most fun part of my job, the teaching part, the imparting knowledge or seeing someone who starts with something and gets an end product to it or becomes better in stages or over a few months. Like, that's probably, and then with doing...
So sorry, Ro, at this stage, do you have any kids when you were doing this job?
No.
Okay.
I was 25, I'm gonna say 25, I think. So yeah, 23, so 24, and then I was 25 when I did that. I left home and kind of lived in Coventry for a year, and I pretty much lived at the hospital, I would say. I lived across the road from it, and I just turned up whenever there was work to do, because I was like, that's the way to learn. And I to this day will say to people, actually, if you have the opportunity, go and do 6 months of a MaxFax job. And not because you want to do it as a career. Actually, it's okay not to do it as a career because it's a big ask. I don't, like, even if when I start getting to that stage where I'm training dental core trainees and things like that, I would say the same. But the 6 months, I think, makes you a better dentist in what you do, because you see all these medical things and you see these medically compromised and patients, and all the ones that actually general practice don't see, or will say, I'll refer this onwards because it's too complex. And you tend to see all of it and you work out how to do these things. So then when you leave and you go back to practice, actually, when things go wrong, how much you beat yourself up about it is just a bit less. And we all do it, right? We're all, I think in dentistry, most people are like this, where because it's you and you're responsible for that end product, you really beat yourself up about something going wrong. And you don't see the bigger picture of, yes, it's just a tooth, but also there were many factors in why that might have gone wrong. It's not just you doing that procedure, which is why it went wrong. And like, so that kind of, I don't know, I've kind of gone off track a little bit, haven't I?
No, it's great.
No, it's great.
It's great. I mean, because really, I mean, I think that there's a couple of really interesting things that you've touched on. That, you started by talking about how you went into dentistry for the work-life balance, and then you threw that out the window, and that would be interesting to talk about. But also, people listening to this might be considering whether it's a rotation or a career in MaxFax, and I think it's really interesting that you've had an experience where, probably because of how you are and the fact that you dedicated yourself, you got opportunity. But do you think there's anything about the hospitals that you chose to work in or that you got placements in, and whatever it is about them, the type of people there, the areas you went to, the size of the hospital, that contributed to you getting to do so much?
So the places where I was, like Coventry, a trauma level 1 centre. So you're getting things coming off the M1, like all the road traffic accidents, things like that, and all the sort of high speed trauma. It's got one of the biggest, I think, ITUs in the country. So you see, and when you have trauma centres, they have basically every specialty within the hospital, and so you don't get referred out for stuff. And when they're structured like that, you do see all the complicated stuff. But actually, like, how I landed that job, I'd applied like to loads and loads of different places for DCT. My CV wasn't amazing. I didn't have lots of audits, things published, or anything like that. Actually, my CV was pretty bare, and I was shortlisted, or I was longlisted then shortlisted, and then essentially I was on a waiting list, and I just got lucky. Somebody turned down the job, they offered it to me, and essentially I was like, yeah, I'll take it. And it was just out of sheer luck that happened. And then it was just about, once you've got, I guess sometimes doors open or you get lucky, then you just have to kind of force that door open a bit. So that's where I decided, right, no matter what happens, I'm just going to work hard, learn what I learn, and then I'll make a decision about whether I want to commit to this career or not.
So, Ro, what inspired you to go back into the hospital after VT?
Probably just to see what it was like. I had the four walls, and I think for me, it started to make me think, can I do this for the next 20, 30 years? And arguably, I didn't know what that looked like for me. To me, looking at thinking I'm going to do perio every single day for the next 30 years was... And I think I was just like, right, I just want to... Because I was saying the same things, right? Like when you do, by the time you get to end of VT, arguably you've pushed the boundary quite a lot through that year, but then you feel less protected, you leave, you're on your own a little bit, and you start to, certainly when you first start, you start to shy away from some of the decisions you make as well, because you feel like you're starting again on a different track, and the whole thing with litigation, complaints, the way like complaints processes happen, and everyone worried about their registration number. Actually, like hospital just seemed like a bit of a win to learn something more, and just your early years of dentistry is where I think you gain a lot of your skills, because after that you're like, I'm happy set in my ways because I find that things work in my hands. So like I just left and was like, actually, let's go and try a hospital job. Let's see what it's like. And it's so different. There's an element of camaraderie. There is you're working in big teams. Actually, like you've got so many different multidisciplinary people involved in what you do. Whereas in practice, I felt like it was just me. I'm going to make all the decisions. And I think I quite liked the idea of making decisions in teams, having other people around. But it's very interesting you say that, because actually when I spoke to a consultant, he said to me at the other end, it's the same. He said to me, as a consultant, you are on your own a little bit, because the buck stops with you again, and you then make them decisions. So that's how it started. But then when people started letting me do stuff, I was just like, right, I want to do more. And you're restricted without the medical qualification, I think, depending on where you work. In some places, actually, like, I have dental friends who have been very, very fortunate and supported in what they do, that actually, like, in some places, they're basically doing skin cancers and things like that, and they're doing that as singly qualified dentists, which is amazing, right? It just depends. In right place, right time. And so they've been very lucky, but I just thought, I don't want to rely on luck. Like, if I can work hard and just earn the right to do these things, actually, let's go and do them. And I always said to myself, if it ever affected me in the long term, then I would give up. And I've always got this, like, dentistry is a fantastic career and what it is and what it can give you, that I was like, actually, you can give it up. You can do general dentistry or like oral surgery now, I guess, and that's always a great backup plan. And there's things like what we talked about with implants. I don't know how that's happened. Yeah, like there's things like implants, there's oral surgery, there's sedation, there's so many things you can do within dentistry.
So is this your phase of stepping away from MaxFax?
Right now, we're doing the
Yeah.
implant stuff, as in, so I've started doing a diploma in implants, but I'm not stepping away, to be very honest with you. I'm actually applying for my registrar job at the moment. I just did the diploma in implants, I guess as a bit of a backup, but also when you CCT as a consultant or you finish your training, it's part of your exams are dental implants. So you do have to learn it through your training anyway. So I was like, why not start early? And I've spoken to people throughout. Obviously, we had a good chat about it all as well, and it just seemed like a sensible option because I can do the oral surgery stuff, and I do a lot of it, and I just thought it's just something to add to the armamentarium. And maybe I'm a bit crazy because there's enough learning in MaxFax that has to happen as well. And I do think, when do you find the time? But if you keep telling yourself when do you find the time, you'll never make the time for it. So I was like, actually, let's just see how it goes. And if I decide not to do it, it's fine. I think I'd accept that I decided actually, because now that I've started the course, I've realised how involved you have to be and the amount of commitment, like you guys will do, when it comes to your patients who are having dental implants, what you need to do, the pre-preparation, the planning process. But actually, like, things go wrong in anything that you do, in oral surgery, things go wrong, and you have to manage that. And in truth, I don't think that at this stage I'm willing to sacrifice my interest in sort of head and neck cancer and reconstruction to focus on dental implants. So I probably at this stage am sitting on the fence about whether I'll even continue doing it.
So, Ro, there's really some really interesting topics to touch on. Like, I want to come back to, some of the things that you've mentioned that you want to be doing more of. You want to be involved in head and neck cancer and these things. Let's come back to that in a second and why you want to do those. But I thought this is a good time I hope you don't mind, you and I had a chat, and there's a couple of things that I thought would be really nice, if you're happy to talk about them, because there's going to be people listening who are making these decisions about their career. And two of the things that we spoke about is, we both have kids, so we were talking about like work-life balance with family. So talking about that, but also the fact that during your training years, you have to make financial sacrifices. It's part of the journey of MaxFax. And so, if you're talking to someone who's at the beginning of your journey, what do you wish someone had told you about work-life balance and finances, and would it have changed anything for you?
So actually, like, when you start in the career as a dental core trainee, you're probably the most present person in the hospital in terms of how you commit to your work. And that's where the hierarchy goes, right? You have, or everyone would have heard of this hierarchy of SHO, registrar, consultant. Registrar is that person who has quite a lot of knowledge, you're that man in the middle, and you kind of manage to go between. And then you've got your consultant who does all the major work and all the major operations, makes most of the big decisions. And they're essentially the person at the top. When you're an SHO, you do a lot of hours. So you do weekends, on-call, nights. And I think you don't get a work-life balance when you're there, but that's when you're quite young. And I guess, like for me, I didn't have kids then. I was getting married, but we didn't have kids. And so it was okay for me to do them things, and it was fine. The bit that I guess no one really talks about is once you're dual qualified, you go back to doing that. So you go back to being this junior doctor who is like F1, F2. Core surgical training is the same. You're still doing nights, you're still doing weekends in the same respect. And you do something similar as a registrar, but you're what we call second on call, which means you're there to make the decisions down the end of a phone often, and if there's an emergency, you go in, you sort it out, and then you can, generally speaking, leave. And that's within MaxFax. Every specialty has it different depending on how busy you are, how acutely you need to be. So we're called non-resident on calls, like when we do them as a registrar. So that becomes a little bit easier in terms of balance, but it depends how far you are from the trust at that stage. It is an engrossing thing in terms of that, and in terms of work-life balance, as I say, I don't think you will get that, but there's nothing wrong with that. Like, I think lots of people see it as you must have a work-life balance, but most of the people that I ever speak to, they might say I have a work-life balance, but most of them are quite obsessive in their jobs at the same time. Like, and they're quite involved in what they do. You can like Flo, obviously you got to do your race on the weekend, but it sounds like even then you're still quite involved in what you do in your work. Ali, you're the same. Like, I see your name popping up everywhere and anywhere, like when it comes to implants. And you can say I have a work-life balance, but arguably you're probably on your laptop a lot when your kiddos go to sleep.
Yeah, that's fair. That's fair. And I guess the way you're saying it, the takeaway for me here is we may be looking at you and going, wow, what a big sacrifice. But you're so passionate about what you've been doing and you see the cause in it that it doesn't feel as much of a sacrifice because you love it. And I guess that applies to anyone in any field in a way.
Yeah, I always say and this is, I teach DCT sort of oral surgery and stuff once a year. And I always say to them, find what you enjoy, because then it just doesn't become as hard. Anything that you want to be good at, or anything, if you think about just the prime examples of people who are at the best of their careers, the sacrifices that they make, examples of LeBron James, Cristiano Ronaldo, like you talk about people in how they do things and how they conduct themselves. Actually, like, they made massive sacrifices, but they love what they do. Like, and for me, like, my wife always says it to me. She's like, bro, you're lucky to have found what you love doing, because actually, like, not everyone does. And then it does become a job, and people are like, how can I get out of doing so much of it?
So I guess passion is a big part of how you feel about the balance that you have.
Yeah, yes, exactly. So I am often working, like today as well. I think once we finish on this call, I'll probably have to do some stuff on my computer, but I don't mind doing a lot of it. And everything that you do, everything has highs and lows. Some things are hard and everyone hates doing that. I'd say I'm not the best at publishing, and it is a part of our job to do it and part of our career and our pathway. And it's something I've had to learn over the years, rather than be like, yes, I'm a natural. Like, I can say, like, actually I like talking to patients, my communication skills with patients are good, but you have to kind of fill all the boxes, don't you? Like, you have to kind of fill all of these little things, and that's the bit that I find sometimes is hard. Nobody is perfect. And I think that bit is the difficult part of any career that you will go into, and even DCTs who want to come into MaxFax. Like, it's...
Ro, how much support is there for the aspects that people might not be so good at in the hospital? Do you have like a community of people that can help you learn these things?
Yeah, huge, absolutely huge. So if you come in and say, I want to learn, and you show a willingness to learn, everyone makes time for you. Registrars make time for you. So, like, I will supervise DCTs, and I will say, what bit of this do you want to do today? If they show willingness to learn. So, and willingness is me saying, you're coming to an operating theatre, do you know the patient? So my bosses expect the same. So when we've got like a fractured wrist, a hip that needs a hemiarthroplasty or something, if I turn up to the operating theatre having not looked at the notes beforehand, or not know even a medical history, let's say, and they're on an anticoagulant, they're not going to let us touch these patients, because they're going to be like, well, you don't know the patients, you can't expect to come here and do something. And I think that's the only attitude people have in the hospital, is if you prepare and you know them, honestly, like, when at my stage, I couldn't believe it. As a dentist, like, people were letting me obviously fix mandibles, but I was doing abdominal skin grafts as a like second year DCT. People were letting me like stitch up people's wrists and things like that I didn't expect to do at that stage. right? Like, and there's always this like, anyone will let you do stuff, and people are really willing to teach you if you just put the time in to prepare.
So prep is key. It's turning up like beforehand and actually doing your homework and having that attitude to be there, rather than how can I get away with putting the minimum amount of time in or minimum amount of effort.
And you get a mix of people, because we do get like dental core trainees who say, I don't want to do this as a career. We'll get fair few people who want to do orthodontics, pediatrics, other things. And I'm still happy to train them. I'm saying, look, you want to learn, come and learn. But we'll also get that balance of people who say, I'm never doing this the rest of my life. I don't want to know it.
Yeah, and they're just ticking a box.
And that happens. And when you get that, that's the hard bit, to kind of be like, how do I want to engage you, I want to help you, but you're not making it easy for me. Mm-hmm. So then it becomes very difficult. And I think my consultants or people I've worked with, obviously they've been doing this for 20 years. And if they've had that every year for 10, 20 years, you can imagine by that stage, they'll be like, I don't have the time.
Ro, talk to us about, you said going back to kind of being the on-call and having to, like, you're bottom of the food chain again when you completed medicine. You're also bottom of the financial food chain again, and you now have mouths to feed and a family. So what's, there's no magic answer to any of this, but what's that experience been like? How do you guys get through that?
So actually, it's actually from finishing DCTs. So when I finished my dental core training jobs and I started med school, I was at a point where we basically had a 1-bed flat here up the road from here, and we were putting the mortgage on this flat on a credit card, interestingly, just because I'd run out of money as I started med school. It was an interesting dilemma to be in, and I had amazing consultants who I basically sent a message to one of my consultants who I'd worked with before, and I said, I'm struggling for money. Do you have any work? And we might have to edit this bit a little bit, but I don't know how to word this properly. But basically, what would happen is on my off days in med school, I went to see him once. He said, just bring your CV and your paperwork in Coventry. And I went to see him. And
where were you living at this point, Ro? So you all the way to Coventry then?
So it's about an hour and a half from here. And I went to see him, and I said to him, I took all my paperwork. He basically walked me around to the managers and just said, this is one of our old trainees. I'm happy for him to do theatre lists on his own. Can you give him some? And that's where, so that's where my money ended up coming from. So he basically did that. And Northwick Park Hospital, some amazing consultants there basically supported me again and gave me a job locally. And these are locum jobs essentially. So the non-contract jobs, but your hourly rate. So you get paid an hourly rate, which is quite good. And you need the flexibility with it as well, right? Because you're in med school, your timetable changes, I guess, on a weekly basis, but you have it for a few months. So you can kind of plan. So a lot of it was just prep work. And so what happened was these jobs got me through med school. They paid reasonably well. I can't say I earned lots of money, but like 30, 40 grand a year whilst you're a medical student is not bad at all. And it will get you through, like it will absolutely get you through. You just kind of change the way you live a little bit and your lifestyle, right? It does become hard, I guess, in the sense that your peers around you are obviously doing very well, and their lifestyles are very different, but I kind of had a vision of where I'm going, and I was like, I'm going to just keep going.
Well, it's a bit like dental school. When we go into our clinical years, all the people in 3-year degrees have qualified and they're earning money, and we're still, going to find the yellow stickers at Tesco at 11 p.m. to see what we can get. Ro, that's amazing. So that's how you basically had almost a full-time job whilst being a full-time med student. And the what you had put in before you went to med school gave back to you. Was there a backup plan for any financing?
No, so when I did foundation year, this is the bit where I always say to people, now find a balance, because F1, F2, you're doing on calls, weekends, like you're doing all this stuff. And what happens is this is what an average rota would look like. Let's say, so you're working Monday, Tuesday, Wednesday, Thursday. And if you're working the weekend, what happens is you get a 0 day before and after. So you don't work the Friday, you work the on-call, which is a 12-hour on a Saturday, and you work a 12-hour on a Sunday, and then you get the Monday off, and then you're back to work on the Tuesday. So that's how it would look. And so what would happen is, I guess in hindsight, a part of me thinks this was probably a bit silly, but at the same time, I'm sure all of my colleagues have done the same. They would work in a MaxFax unit on the Friday and the Monday. And that's what I did. Like, so some weeks you'd end up working loads and loads, and then the bit that you don't realise is that it catches up with you with time. Because you're not taking the breaks, you're not taking the rest that they tell you should get and you should do. And what it ended up being, and this is really important, I think, is that I ended up taking a couple of years out of my training. I took 2 years off after foundation, which is when my daughter was born. Best decision I think I ever made, because at that point I just had to reflect on things and just say, I had some family stuff. My dad wasn't well, which was a big thing for me. So actually, like, having done that all and taken a step back, I was like, I can decide, do I want to continue? Because MaxFax is a journey. It's not, and don't think I just want to be a consultant. Actually, enjoy the journey as it goes along. I've learned so much through my years. And so, yeah, I got to like that stage, and financially, I was like, I just wanted a little bit more money at that stage. But there are so many different pathways now. So I have friends who have dropped out at F1, foundation year 1, because of the financial difficulties. And now there's something called a CREST form or CSER, and it's basically saying, because you've operated through medical school, you've done lots of operations, you have a lot of experience, and you're not that general junior doctor who's never done an operation before. So you can now get signed off by equivalence, which is just saying it's a competency-based training. So people are working, locuming, earning a reasonable income, and then when you're a registrar, actually you do okay. It's not amazing, but it is enough to live off when you've got children and a family. So lots of people are doing it that way, and that's a reasonable path. I'd like to do core surgical training, and now I don't regret it. I've done ear, nose and throat surgery, which is a very allied specialty to what we do in MaxFax in terms of head and neck, scopes, knowing what's going on in the throat, the tonsils. So it's very, very good. And then the orthopaedic surgery has taught me a lot about trauma. So I have no regrets. But I've done it at 60%, so I've decided I wanted to do a little bit of oral surgery on the side and keep up that skill. And so I've done it at 60%. It's not really extended my training time much, and it's
Ro, what did you do for your 2 years out?
MaxFax and some tier 2 IMOS and oral surgery.
Cool. Okay.
What is tier 2 IMOS oral surgery?
It's like the in-between. So if you're a general practitioner and you find certain things are difficult, you can't do them, or you get patients who just think this will be too complex, it gets referred into this like hub essentially, and then you've got these people who triage it and say, this doesn't need to go to hospital. And what it does is it takes the weight off the hospital as well, and then waiting lists, but also like, when the COVID crisis happened, I happened to get this job. So just as COVID was sort of finished, I got this tier 2 IMOS job, and it was just, there was thousands of people waiting just to have their teeth out, just because of what had happened. And all it is in hospital, with the way things are structured, you'd see 8 to 9 patients a day. When you're out in these practices, actually people see between 16 and sort of 20 patients in a day. So you imagine how quickly these waiting lists can come down. So you'll get things like retained roots, surgical wisdom teeth that are away from sort of nerves, and anything sort of difficult, or where a tooth has snapped and the root's left in, and sort of your dentist thinks, or you guys think it needs to be removed, then it will get sent to us, we assess and go from there.
What qualifications do you need to be that tier 2?
To be honest with you, not much. So the bit that actually for most people is when you work in hospital, if you have this goal in mind, so do a dental core training job or just do a clinical attachment in hospital and gain the experience there doing oral surgery. So when I applied to get on that register, I was just finished medical school, but all I'd done was take out teeth. I didn't have a piece of paper that said, like I've done a diploma in minor oral surgery or any other oral surgery course. I'd never done anything. I had bosses who had basically let me do a lot throughout my years. And so I ended up doing lots of exposing bonds, difficult wisdom teeth, small cysts and things like that. And so I just put that down. So keep a logbook. That's what I would say. If you're someone watching this and you're junior, keep a logbook. There's a Royal College of Surgeons e-logbook. Definitely keep that. And then just log your cases as you do them. And by the time you're at the end of even DCT1, you'll have accumulated a whole number of cases. And then you just apply to a panel and you say, I've got this. They do ask for quite a lot of criteria that you have to fill. But obviously the main thing is you're working within your remit and actually you're safe. Like that's all they want to know. But they judge that and then they'll say, the panel will say, you're not qualified enough, you need to get more of this or this, and then you kind of just chase it up. Once you're on that, it's actually a really good pathway. I think it helps general dentists out a lot. And what's happening at the moment with the whole NHS crisis and trying to find a dentist, what we're seeing is an influx of, I went to see an emergency dentist, they couldn't do this and they've referred it to this service. And that's where we end up taking out a lot of teeth in that sort of by that avenue, but patients are happy, they're getting something done rather than being left in pain, and they're not waiting months and months. Our waiting list is about 3 weeks at the moment.
Wow, that's amazing.
Ro, can I ask you, sorry to take it in this back in this direction, but you have an interest in trauma, facial deformity and head and neck cancer.
Yeah, so
why those?
So trauma and facial deformity. So trauma and facial deformity come normally as one, and then head and neck cancer is the other things. They're the two things I've been exposed to the most. Head and neck cancer are these big, long 10, 12-hour operations that you hear about, where you've got two consultants working together, you've got two registrars, so you work in these really good big teams. But the cancer side, I always say, like, anyone can remove a tumour because all you do is follow the size of it and say, let's take this out. My view on it is actually the reconstruction and putting people back together, getting them back to a level of function and rehabilitation. It's not perfect, but what it does is, like, we're talking about, like, if you have your tongue, part of your tongue removed, you've got radial forearm to reconstruct it. So you're taking part of sort of a skin paddle of your arm, you're taking the artery, the vein, and you're basically plumbing it back into the neck, and you're saying, I'm going to put a viable bit of tissue into your mouth so that it doesn't scar and so that you get a range of movement and so that you get some swallowing function back. So you're kind of getting these people from a stage of, right, you have cancer to no cancer but functional, so you can now eat and drink. And I'm not saying everybody gets to that stage. Okay, some people don't, and I think that's one of the realities of sort of cancer, but that's where that came from. And I think the people who I have watched do this and assisted in these surgeries over the years, I find incredible. Like, I find it incredible just watching them from the start, where you're planning this operation, you're looking at the scans, you're talking about what you do, to this big team of people that then is involved. So you've got speech and language therapists, dietitians, physiotherapists, and you've got this whole team of people. And then when you're in that actual operating theatre, it's quite a nice environment. It's calm, it's a controlled environment, and you've got a colleague who you work with, which is great. I've always liked the idea of working in teams, like, and I'm very, like, work within your remit and ask people for help where you can. And I really like the idea of that, even if it's just a 5-minute, what's your view on this? Because it might change how you look at something. Ultimately, you still make the decision. And then the trauma deformity is just because you get to do a lot of that as a junior. So I have been lucky enough to do lots of sort of, I guess, mandible fractures and fixing them. And in terms of deformity, you've got sort of bimaxillary osteotomy, so you're sort of taking a maxilla apart or a mandible apart. Again, that consultant who I started with in Coventry in 2013 has taught me all of this over the years. And well, a couple of consultants there in Coventry have, and Norfolk Park the same, like the consultants that I got to work with have taught me this stuff, and I think that's where that's come from. It's the bits that I've been exposed to the most. There are other bits of what we call craniofacial stuff and sort of pediatric stuff that these experts doing in sort of Great Ormond Street and stuff, but I haven't really had lots of exposure to it, so that's where my interest comes with these two.
That makes sense.
Yeah. I'm having a real full circle moment here. I'm sorry, it's slightly off-piste here, but as a child, I fell over and cut my tongue off. It's why I went into dentistry. So it's really funny you talking about this, because I'm like, oh wow, this is literally what I had done to myself. I mean, it didn't come fully off, and they just stitched it back together, and it's absolutely fine. I mean, there's a bit of a scar, but I was absolutely fine, and I lived on mashed potato for 6 weeks.
Win.
Yeah. Well, they said, oh, you can just eat ice cream. It was like cold and soft, but I couldn't deal with the ice cream, so my mum just gave me mashed potato for 6 weeks, and I still like mashed potato, so it clearly didn't completely put me off.
But that's amazing that the person who put that back together, the amount of training and sacrifice and commitment it took to get to the point where you can help that kid who's been through that is unreal. It's amazing. It was the first line on my personal statement was like, I chopped my tongue off when I was a child, and this is why I want to do dentistry. So I'm feeling it's all very full circle right now.
Interesting thing is, a few months into doing that dental core training job, that's going to be you. So you've left dental school. Actually, that is a junior operation, I would say now. I would supervise a junior doing that and actually putting that person back together. And that's one of the fun things. You go in and you start doing quite a lot quite quickly. If you just, as I said, you just have to show your willingness to learn, and people are like, yeah, come on, let's go teach you.
Wow.
That's awesome, right? Really.
I did want to ask, so you're a reviewer for the British Journal of Oral and Maxillofacial Surgery. How did you get into doing that?
Everyone loves Rohit, and everyone trusts that he'll do a good job when he's given something. I guess that's the lesson.
He was taking a step back from MaxFax. So one of the sad things is that we have a 40%-ish attrition rate within the specialty, and that is exactly the reasons you were saying, Ali. Is life happens, and actually for people they take a step back. Financial reasons, family reasons, whatever it is. And so he was actually taking a step back from the MaxFax career. I think he was interested in doing oral medicine. His name was Nick, actually, and lovely guy. And he said to me, do you want to be a reviewer for the journal? And I saw it as, this would be a great opportunity. Let's just see and try it out. And so all it is it comes by referral. So he referred and said, so what you can do is when they email you saying, can you review this article, you can say yes or no based on, is it your area of expertise or are you interested? And then if you say no, then they can ask you, can you refer on to someone else, or is there someone you know? And I think that's how it came about. And then I've sort of just continued it. I've only done it, I'd say now I've probably reviewed about 20 or 20-ish articles, so not loads and loads. But what it does is that idea of critical appraisal and things like that, the stuff that you touch on at university and you kind of never do again, and you're like, it's a very good skill to have, because as you do more and more and more, you'll start to hone in the idea of just looking at the method and saying, this is not a good paper, I don't need to take anything out of it, and walking away. And you'll waste less time reading the whole paper, basically, with time. I don't think I'm even there yet, in truth. There are a lot of statistics and things that I don't have a clue and don't understand about, that actually it takes me time to understand. But I wanted to add that to my skill set of things that I was like, let's do this and continue it. And it's ended up being quite good. I have learned a lot so far. And also you get to see so it's peer reviewed, right? So somebody else will also review it. And so if somebody, let's say you decide, I think this can be accepted within the journal, and somebody else decides, no, this can't be, they'll put their reasonings behind, and then you'll say, actually, I didn't think of that. That makes sense. And you kind of learn from that as well. So even though I'm not speaking to people directly, I'm still learning something from them.
Mm. Oh, well, no, that's really amazing. You clearly have a real zest for knowledge and like sort of absorbing all of that there. I've really enjoyed today's chat. It's been fantastic sort of seeing that whole side of that sort of maxillofacial journey. Before you go, we have a little quick fire quiz, just so you can earn your dental pearl. It's not an actual pearl, I do apologise. But question 1, what is your favourite procedure to do?
Tracheostomy. A surgical tracheostomy. It is basically a surgical airway into someone's throat. I think I've just always enjoyed it.
Wow.
That's the coolest
that
answer
is definitely
yeah.
the coolest answer. Question 2, what is your favourite scrub colour to wear?
Blue. For no reason. I like your ones.
Thank you.
No. With no context, which is your favourite tooth?
I have to say a wisdom tooth, right?
Wisdom tooth? No. The only ones you'd probably deal with now. And question 4, if you had to start again, what would you like to do?
The only other career I ever thought about was becoming a footballer. But
I love it.
actually, I've loved my journey so far, learnt lots throughout it, and I have no regrets about the decisions I've made along the way. Actually, the people that have taught me have been amazing, and actually very supportive.
It's been amazing, Ro. I have to say, like, for me, the takeaways from today are that it's clear that you do things not to tick boxes, but because you have genuine curiosity. And I think people who go about their career ticking boxes maybe don't get real satisfaction, and everything will feel like a big compromise. Whereas if you do the things that you're passionate about and you love, then you see the good things rather than seeing all the downsides, because every job has downsides. But also, a lot of the good things that have come for you, you've told me this, and you know, you've said it, I think, very briefly on here. You don't come from a rich family that kind of pushed you down dentistry, and you didn't have, you know, I don't want to put words in your mouth, but you didn't have parents just going, oh, you don't have any money whilst you're a student, here's lots of money. You've had to find your way with things. And I think for me, having known you, but also just seeing how little your essence has changed since we were in dental school, it's that actually just being a really good person and interacting with people, but approaching it with humility, where you like being in teams, you like talking about what you don't know and getting other people's opinions rather than needing to be the most, the most intelligent guy in the room. You're saying, what do you think? And I think just your personality and approach to it has meant that you've made a career out of MaxFax rather than trying to race your way to a position. And I think that's really inspirational. I'm just blown away by who you are, and, you know, and kind of the journey you've been on. I think you've always been a friend, but, you know, dental school was a long time ago. And it's a really weird way to say I'm really proud of my friend. And I think it's amazing what you've done, Rohit. Honestly, amazing. Thank you.
I think everyone's in the same boat as well, right? Like, you've started this podcast flow, which is, I think, incredible, actually.
Thank you.
It is, because I like what Ali said, you have to do what you enjoy. And I think if you continue to do that, I always say, like, everything becomes successful if you just look at it and say, I'm going to continue because I enjoy it. Once you find something you enjoy, you find a way to make it successful. Right? Like, because your definition then doesn't change. You're like, well, actually, I still enjoy it. I know it's hard for everyone else, but for me, I'm like, I've learnt lots. People have really supported me throughout, which I've been very lucky about. Yeah, there've been the lows, but you take lows with anything.
Yeah.
I love that. That's a great way to end.
Fantastic. Thank you so much for coming on.
Thank you, guys.
Thank you
for inviting me.